Hello, my name is Ann Sheetz. I'm a member of the Illinois chapter of Physicians for a National Health Program and a founding member of the Illinois Single Payer Coalition. With me here today is Rene Luna, a longtime disability rights and single payer activist. We're going to talk about the intersection of those two movements, in particular in Illinois. Welcome, Rene.
Thank you for having me.
Let's go back to the Americans with Disabilities Act, which was signed in 1990 and was intended to include a prohibition on discrimination on the basis of pre-existing conditions. Tell us what happened with that.
Okay. Well, as we know, the Americans with Disabilities Act bars discrimination on the basis of disability in the areas of employment, public accommodations, telecommunications, and other services, including public services. And in the planning for the passage of the legislation, there were advocacy groups in Washington that included a consortium of people with disabilities, different organizations.
Right.
And we had, at the time, this was in the late 80s, pushed for the inclusion of health care as a civil rights issue.
Right.
And having equal access to health care, because we had known that historically disabled people had been excluded.
So disabled people would have an equal right to health care with anybody else.
Equal
right.
rights to access health care. And particularly because we wanted people to be integrated and have an opportunity to find jobs.
Right.
And we wanted jobs with benefits. And health care is one of the most important benefits.
Right.
But the healthcare industry lobbied to have that removed.
Okay.
So it was not included as part of the Americans with Disabilities Act.
In particular, there were certain legislators, is that correct?
Yeah,
who
from
served the health
Connecticut,
industry.
from the East Coast,
Right.
Senator Weicker, I believe, and others who were lobbied by the health insurance industry. And so they made sure that this important part of our life and our access to health and to the community, there was a separation there. So I think this created a lot of barriers, even though the Americans with Disabilities Act was supposed to tear down barriers. This left one of the most important barriers.
A huge barrier in access to health care for anybody with illnesses or with any kind of pre-existing condition that would require health care.
Exactly. Obviously, many people already received Medicaid or Medicare.
Right.
But the private insurance companies, private industry, could still discriminate.
They could discriminate. So all the way back then, the health insurance industry was interfering with people's ability to get health care. And they would they would place barriers in the way of people with any kind of disability, any kind of pre-existing condition getting health insurance.
That was the thing. Anybody with a disability who wanted to get private insurance, there was always a bar that you have a pre-existing condition,
right.
You won't qualify.
So you could not get private insurance. You could get Medicaid or Medicare if you qualified for them. But if you needed other insurance, you couldn't get it, and therefore you couldn't get health care, or you had to stay on Medicaid.
Exactly.
Okay, so particularly in Illinois, in the early days after the Americans with Disabilities Act passed, people with disabilities came together with the single payer movement to work together. Tell us a little bit about that.
Well, shortly after the passage of the ADA, we realized that health care was an important provision that was missing. And it was about that time that the Clinton administration started to look at the issue of health insurance.
Right.
And changing health care for all. We became involved with the health campaign for better health care.
That was an Illinois organization. And I think Access Living was one of the early founders of that.
We were one of the early organizers. And as members, we believed in universal access. We believed in the single payer movement.
Which would get the health insurance companies out of healthcare. The people who had
It would
kept disabled people out would then be excluded from,
right. It would
from the
create
healthcare.
equal access for everyone.
Right.
And we certainly supported that.
Mm-hmm.
Of course, the politics in Washington didn't permit the movement for a single payer, and instead we got managed care, health maintenance organizations.
Health maintenance organizations are a form of managed care. And what do they do for people, for a person with disabilities?
Well, you have to be going to networks in particular.
Oh, okay. So they tell you which doctors, hospitals you can use.
To go to the networks, and that was always a problem for us because many of us have specialized care.
Absolutely.
So at my organization, where I worked for many years, we had a PPO, a private provider.
Preferred provider organization.
Preferred provider. And I had a choice of wherever I wanted to go for services.
You could go to any doctor or hospital.
Of course, we were paying the premium rates, which meant that we paid more than everybody else, but we needed it. We needed the specialized doctors, and we needed, the quality care.
So if you were in a preferred provider organization, a PPO, you had to pay more for that than people who weren't in a PPO, who were in a health maintenance organization that would have a narrower network of providers.
Right.
You had to pay extra for that.
And I was fortunate to have an organization, a business, that included health care. I couldn't be discriminated against on the basis of disability because my business insured everyone.
Okay.
And that we were paying the premium rates. I had to go off of Medicare because I had been on Medicare before I started working.
So when you went to work for Access Living, you had to change insurance. You had to go from Medicare to an insurance plan that was provided by Access Living, and that you had a choice of taking a PPO.
Right.
Okay.
And when I was on Medicare, I covered 80% of the cost, and going to Access Living, I needed something equivalent to that, so PPO provided me that at least.
Okay. And did you yourself have to, so we're seeing the complexity of dealing with a healthcare system that includes private insurance companies and all these different forms of insurance. So when you went to work for Access Living and you got a PPO, was your share of the premium higher than it would have been if you had gotten an HMO?
Yes.
Okay. You had to pay extra for that.
That's what we were paying for, the quality care. The HMO, obviously, you're told what networks you can choose from.
Right.
You have your options to choose from, so you're limited to those networks and the doctors within those networks.
Right. Okay.
And they would, if you needed some more specialized care, then you need a referral from one doctor to another doctor, and it just became more complicated.
It's more complicated. I want to come back to this in a minute, but I want to ask you about something else, which is, I think was perhaps peculiar to Illinois, and I think also visionary, as was a visionary, the single payer and disability rights movements coming together. And that was the disability rights movements coming together with home care workers.
Yeah.
The people who provide services that people with disabilities need. Tell us a little bit about that, because that didn't happen everywhere.
Well, we had an advocacy group in Chicago called Chicago Adapt. And we had fought for accessible mainline transportation. And ADAPT stood for American Disabled for Accessible Public Transit.
Okay.
So after we had the victory with the buses being equipped with lifts here in Chicago, and that was nationalized by policy and under the ADA, all transit agencies had to provide accessible mainline transit.
Right.
So ADAPT went on to another issue area, and it was decided to work on that the issue of home services was most important, and that we wanted to get people out of nursing homes. Too many people were being segregated, institutionalized unnecessarily.
Right.
So many of us who had home services here in Illinois, we had workers coming to our homes And back in the 1990s, early 1990s, they were being paid as little as $3.15 an hour.
Right.
And that impacted us as well.
Absolutely.
Because it was hard to find quality home care workers.
And did those workers have health insurance?
They had no health
No
insurance.
health insurance.
No
Really poor
benefits.
pay, no health insurance, no benefits.
at all. No time
So
and a half.
all of you
nothing.
were suffering together.
We were suffering together. We worked with the Service Employees International, Local 880 at the time. Now they've reorganized and have changed their name. But we formed a coalition with them, an alliance, and we worked with the state legislature. We educated the representatives in Springfield, and we managed to slowly creep the pay up, and now I think it's about $13.50 or something an hour.
Okay. And how about health insurance? What happened with health insurance for the people with the home care
We're
workers?
still fighting for it.
Okay.
We're still fighting for a single payer system.
How about, do they have any kind of health insurance, the home care workers?
No.
They don't have any health insurance right now?
Not that. Oh well, obviously they can apply for Affordable Care Act.
Okay.
But that's still costly.
It's costly.
And when people are making $13 or $13.50 an hour, they have to pay rent. They have to take care of family. They have to buy food and other things. On top of that, they have to pay for insurance. So this is an exorbitant cost.
And so when you talk about, when Chicago Adapt and the disability rights movement talks about single payer health care, you're talking about health care for you, for the home care workers, for everybody, that everybody's
Exactly.
going to have the health insurance.
Exactly, and including long-term care. I think that was the other thing that we managed to educate many people about, including the single payer movement, because there had been a long presumption that people would go into nursing home and that it was an okay place to be. So we even had to change our philosophies about people not living in institutions, that we have a right to be integrated and to live at home.
Absolutely.
I think that was one of the slogans, in our homes, not nursing homes.
Right, yes, that's right. We've chanted that many times at demonstrations. And actually, it's significant that that HR 676, the Expanded and Improved Medicare for All Act, the National Single Payer Bill, it was written in Illinois, and it includes a statement that that every effort will be made to provide services in the community instead of in institutions.
Exactly.
So that came out of the Illinois work.
And I think it was consistent philosophically with the whole independent living movement
Absolutely.
and disability rights movement. A lot of it was a rejection of professionalized services where the disabled people were simply recipients, passive recipients of services. And we were patients, and we fell under this medical model where we had no control and no choice. So the disability rights movement rejected this philosophy of the medical industry. We said, no, we should have our right to choose whatever services we want.
We decide.
And we need to be in control, not the doctors.
Right, okay.
Not the medical profession.
So now I want to talk a little bit about your personal experience, both. So on the one hand, people with disabilities need health care, and which they're often denied. And on the other hand, they need to be in control of the health care and making the decisions. It's not that the medical profession is deciding what your lives are going to be like. Those two things need to work together. And I know that you've recently had a change in your insurance status because you were laid off from a job. Tell us what that's been like for you, and what have you had to deal with in that transition when it comes to health insurance and access to health care?
Well, I think the impact on me, going from one phase of being employed to being unemployed, as I am currently, has created a lot of anxiety, because I'm no longer on PPO.
Right.
I will have to transition into an HMO. because
Why?
I can't afford
Okay.
the PPO anymore.
That PPO is more expensive, and now this has to come out of your own pocket.
And
You
I
can't
don't
afford it.
qualify for Medicaid
Okay, you have too much
because
money.
I've worked, I've
Right.
developed too many assets,
Right,
and I'm not old enough for
right.
Medicare yet. I can apply for Medicaid after I've been accepted for SSDI, so I have to apply for SSDI,
And what's SSDI?
Social Security Disability Insurance,
Okay,
which
is,
implicitly the idea is that you're too disabled to work, or you can't work because you're too severely disabled.
which is not the case.
And
for
I'm
you, right?
not.
You can work.
And I do have a severe disability, but I can work.
Right,
So we have worked over the years to change some of the policies.
right.
But I have a 2-year transition period to be able to qualify for Medicare again. So in the meantime, I'm going to have to pay out of pocket for managed care for the HMO.
And which is not even going to give you the care that you want and need.
And I won't
And-
get
and
the
you're gonna have to pay
specialized
for it.
services that I need. I've been going to the same service provider, to the same hospital and clinic for about 30-something years. And now I have to look around. I have to do a lot of homework and see what physicians are good for me,
So
what network will be good for me, what's close to my home.
So the hospital you've been going to for all of these years does not accept HMOs, is that
They
correct?
do not accept HMO.
Okay. So they were accepting the PPO and they're not accepting the HMO. So this hospital, which has your records
Exactly.
for
Now I
going
have to
back
get
years,
everything
and very
transferred.
specialized records.
Yeah.
And just think of what it's like for the new people whom you're going to train to take care of you,
It's a
starting from scratch.
whole
after this.
re-education process. And that's the anxiety that I think not only has affected me, but it affects many people.
Right. It's bad
but
enough
with-
to lose your job, and now you have to deal with this.
Even with a less severe disability. Obviously, I have a physical disability. I use a wheelchair, and I have for many years. But many people have some other health conditions. And, my brother has diabetes and other
Right.
issues. As we grow older, we acquire disability, and we don't make that connection that we assume we're going to be quote-unquote healthy all our lives, and we won't ever need it.
Right, which none of us is unless we drop dead one day.
We never know
Right.
when something
don't
can
know.
happen. You could be crossing the street. Here, you could get shot,
Right?
and you can find out you have a disease, an illness. Our families are affected.
Right.
Because it not only affects the individual, but the family unit as well. There are many cases where people are in their 40s, they own a home, they're paying their mortgage. All of a sudden, the breadwinner in the family, if only one person's working, they become disabled or they have a health condition and they're unable to work, or their work becomes limited. Financially, that's a problem. And they can't afford all the insurance and to take care of the family at the same time.
And they could lose their home. They could go into foreclosure.
Many people
on the
have.
home.
And then we have a downturn, the Great Recession that we recently experienced. We saw many people who developed a health condition. At the same time, they became unemployed, and it was a catastrophe. So we go into debt, and people are living in debt this way.
Absolutely. And as we know, more than 800,000 people every year in the United States go into bankruptcy because of medical debt.
It's terrible.
And for people with disabilities, or anybody who has, yes, for people with disabilities, other people too, your choices are to remain poor enough to get Medicaid,
Exactly.
or to struggle along, maybe go into debt, go into bankruptcy,
Yeah.
trying to pay your medical bills.
Yeah, and people talk about the issues of poverty, but they usually exclude the fact that half of the people on poverty have some form of disability, some type of disability.
And people with disabilities are way overrepresented among poor people and are poorer than other people.
We are poor. We're
Whatever
the poor-
category
the
you
poor-
go into.
among the poorest of the poor.
And instead of the healthcare system providing you with the means to work, to take care of yourselves, the healthcare system is actually bringing people down.
It would alleviate many of the social problems that we have nowadays. We have to take care of our children.
Right.
We need daycare services.
Absolutely.
We need, many people would be more willing to go out and look for employment, even if it was part-time, if they could get guaranteed insurance.
Guaranteed insurance. And we could extend that to say people should have guaranteed insurance, guaranteed health care, and also guaranteed guaranteed child care.
And child care.
Guaranteed education, the things that we all need in order to be part of our communities, active in our communities.
We should be free from poverty.
We should.
And health care for all would be one of the ways that we move in that direction.
Absolutely. Renee, we're almost out of time. Can you think of something else you'd like to say to leave people with, something to think about?
Well, I think the Americans with Disabilities Act created a lot of accessibility for people. We need to continue that struggle, and we need to educate other movements and other communities so that we understand what our issues are and what we have in common. This is just like we did with the unions back in the early 1990s, and like we're continuing to do now with the single-payer movement.
Right.
There are ways that we can collaborate. We have obviously our interests, but what are our common interests?
Absolutely.
And I think that's where we need to pursue, create a larger social movement for jobs, for equality for women, for people of different colors, immigrants, people with disabilities, and others.
And I think the two slogans of our two movements, everybody in, nobody out, for the single payer movement, that tells us what we're all looking for. And similarly, the slogan of the disability rights movement, nothing about us without us. I mean, what a foundation for building a society in which we can all live well.
Exactly.
Thank you so much, Rene, for being here. It's a pleasure.